Hi there everybody, my name is Aubrey, and as you might have seen in my previous video, I just had a CT scan of my neck with some contrast, and as a result of that CT scan, they did find some suspicious looking lymph nodes. So my surgeon then recommended that I get a second biopsy of some of the tissues in the neck that were kind of problematic. So I have seen a lot of different people discuss having lymph nodes removed, and they will go in and on occasion do some additional testing of the tissues around the cancer because this particular cancer has a propensity towards geographic metastasis into the lymph tissue. I might end up with something called a neck dissection, which is a significantly larger scar, and it will allow access to those lymph tissues that need to be excised. So I thought I would just go with her recommendation, and today I went in and I met with the same surgeon that I actually had when I was doing my thyroid biopsy, which was pleasant. He was really nice and he remembered my name, and he was like, "Oh, you're the opera singer. Hey." Hate to say welcome back, but and he was very kind, very positive. They took the ultrasound machine, took it on my neck, they took a peek at what my surgeon had recommended to look at, and he agreed. He was like, "Yeah, let's just pop it in there and see." So this tissue was a little bit deeper than my thyroid biopsy, which meant it was a little bit more involved of a process than I was kind of expecting. So I thought I would document that experience for anybody who ends up going through this process as well. Let's talk about what happened, right? So after finding the lymph node, marking it with a little X on my throat, and after swabbing me with a little bit of antiseptic solution, as you can see there's a bit of discoloration, they had to make a cut into my neck. So this wasn't the same as the previous fine needle biopsy where you could just stick the needle in directly. This one did require a slice into my neck to have a little bit more space, and then he inserted a kind of device which was hard for me to see. I couldn't necessarily see from my vantage point, a device into my neck that helped to guide the needle to the desired point. So with that being said, I could see on the ultrasound machine the device, and it got lined up, and he says, "You're gonna hear a click." And I heard a click, and he did a great job with the numbing solution beforehand. I didn't feel a single thing. The shock of the sound kind of made me pull back a little bit, but you know, he did his best. The negative is that when he pulled it back, he struggled to get into the lymph node. It was kind of hard for him to access, so he didn't really get any of the tissue that he wanted. So he tried again and went in again, clicked it, definitely freaked me out once again. And he did manage to grab some tissue, but he wasn't super confident that it was enough. And he grabbed the pathologist who came in and said, "No, this isn't a viable sample." So I had to try for a third time, which at this point, it was definitely starting to feel uncomfortable. Nothing heinous. I didn't have any tearing up, no desire to really pull, but it definitely felt just like really invasive. I had this guide sticking out of my throat the whole time. The guide never got removed. The needle did, but the guide stayed in my neck so that they didn't lose the lymph node. And third time's a charm. After that third click, he did say that he got enough tissue for the sample, and now I wait for the results. Just as a content warning, I will be inserting an image of what this site looks like, so if this is not something you're interested in, feel free to scoot ahead. But for a couple seconds, I will have this on the screen. So this is what my neck looked like afterwards. It really isn't a very big wound. It isn't super painful. It honestly feels more like a bruise than it does like a cut. I'm not super surprised that I needed to go in for this biopsy. As a little bit of recap, I do have Hashimoto's, and I've also had chronic lymphadenopathy for about 6-7 years now, so they've been large and in charge. So I'm kind of glad to get this biopsy anyways. And as some people might already know, when I was going in for the ultrasound on my thyroid, I actually was going in for an ultrasound on my lymph nodes because that was my major symptom. And I was technically supposed to get a lymph node biopsy back then, but when they found the nodules on my thyroid, they decided, Well, we don't necessarily need to biopsy the lymph nodes yet in case they are actually a result of the cancer, so we don't need to poke more often than we need to. Anyways, I look forward to making my next video for you guys. I'm currently in the process of doing some non-thyroid cancer related material, thank goodness, and I'm looking forward to posting that for you guys. And even though it's definitely a little bit harder for me to do this today, please always try to remember to keep singing. Hello everybody, I'm here for a follow-up update on that biopsy that I told everybody about earlier. So I did get the results of the biopsy and it's not exactly what I was hoping for. Turns out that the cancer has left my thyroid and has migrated to lymph nodes. So basically what that means is my current team of surgeons, which works for a pretty small clinic, do not feel super confident that they would be able to provide the absolute best of care for the condition, and have recommended that I go to a bigger hospital with a more substantial cancer program. So I will be transferring from my current surgeon to another team of surgeons and getting to know them and talking to them about my situation as a opera singer, and hopefully they'll be as understanding as my current surgeon is. She was wonderful. So she scheduled me for that other biopsy, which is healing up very nicely. It's just a little bit of a mark. You can't see it very well with all the lighting, but it's a little bit of a bruise. I feel great. After the biopsy, it was totally fine. Had some headachiness, but that could have just been from stress, to be totally honest. Being told that you have metastatic cancer of any kind is kind of scary, and she has basically confirmed that I will be doing what's called a neck dissection surgery, at least on this side where they are sure that some of the lymph nodes have the cancer. I'm hoping that it's not on the other side too, because that would kind of be a huge bummer. I don't really want to go all the way across, but as of right now, I will be no longer having a thyroidectomy. I will be canceling my thyroidectomy surgery and meeting the new team and rescheduling for a neck dissection. So that will be removal of the thyroid in its entirety, along with a series of lymph nodes and then any surrounding tissue that also might be suspicious, meaning my scar will be significantly bigger, the recovery might be a little bit harder, and I also am going to have to do radioactive iodine treatment unless the other team comes up with some other solution. But according to this surgeon, she basically made it pretty clear I'm going to end up doing that, which was kind of what I didn't want to do, to be totally honest. If I could have gotten away with not doing the radioactive iodine, I probably would have not done that. And mostly just because I really don't want to be separated from my cats for days and days. But you know, I will be continuing to listen to my surgical team and my endocrinologist and continue to work on treating this condition. From what I understand, it has a relatively good cure rate still. The negative is it's just a higher recurrence rate. So although I don't think my mortality is going to increase, dealing with them popping up in other lymph nodes and continuing to deal with treatment might be something that I have as part of my life for the foreseeable. I'm hoping that all goes really, really well. They get everything and I can do the rest of the treatments and be in the clear. But I am also emotionally prepared for it to come back and require more treatments, surgeries, and additional radiation treatments. So I'm hoping that that doesn't happen. But you know, with this whole process, I have learned there's no way to predict what's going to happen. Fundamentally, I am scared of losing my voice. And I found that doing YouTube has allowed me to foster some interests in and around the music world that hopefully will satisfy that itch for me to be involved in the music scene if for whatever reason I lose my voice even for a few weeks. So although I'm not excited about the process of, you know, having surgery and having treatments afterwards, there are good things that will come of it. I don't know exactly what those are yet, but all in all, I still feel very positive, and I still feel like this is a bump in hopefully a very long road for myself in terms of like lifespan and experiences. Because even if I can't sing very well for a while due to inflammation or irritation or God forbid some sort of injury, I do still love to teach, and I do still love to be involved in the music world, and I don't have to be able to phonate in order to do that. So, you know, it's a crazy time. Here's to 2022. And as always, keep singing.